Derita, derita, derita. Stop, stop, stop. Okay, okay. Hop, 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 hop. Don't move, asparagus.
Hey guys, what's up? This is Stephanie and welcome back to my channel. So in the video today, I want to be talking about what to do when you are shadowing a PA and how you can shadow a PA. I had made this video a while back, but I just kind of wanted to update it since I've been in clinical rotations and I've been working alongside doctors and physician assistants, nurse practitioners, and I think I've gotten a lot more knowledge in regards to what it takes to shadow a PA and what to do and look for when you're shadowing a PA. So hopefully this is helpful for those of you who are wanting to become physician assistants, are interested in the PA field, and you know, the majority of universities, if not all of them, do require a certain amount of hours of you shadowing a physician assistant, so it's really, really important that you do if you can. So first off, I want to start with the first topic. Is basically how do you find a PA to shadow? And with that, I have to say that I was lucky because I did work with a lot of PAs. I worked in the emergency room, I worked in urgent care, I worked in OB-GYN, surgical settings, etc. So I worked alongside PAs, and most of them I would just ask them, can I shadow you? Because sometimes when I was working, we were just so busy, I wasn't able to shadow them. You know, sometimes we didn't have like a time where we didn't have as many patients, and I had free time, and there would be cases also where some of the doctors and PAs I was working with, they would tell me, hey, like, come look at this is really cool, or let me show you something. So I would go there and be able to see like certain procedures, or if they use UV light to look at the skin for certain like fungus, etc. So that was pretty cool, and when I did have downtime, I did go back there and shadow them. And I was lucky in that area, but I know some of you maybe don't work in the medical field and are looking for a PA to shadow. I would definitely start with your own medical provider, whether it's a physician, see if they have any medical providers like nurse practitioners or PAs, and see if you can shadow them and ask them. Most of the doctors or staff, whether it's your PA or your own doctor, they're very amenable and they are very kind, and they will say yes. I know that once I do graduate, for those of you who will be in that area, and I'll let you guys know wherever it will end up, since I really don't know where I'm going to end up working, since my husband travels a lot for work and he moves for work, so I don't know where I'm going to be. I'll let you guys know, and you guys are more than welcome to come and shadow me. But yeah, I would start with your own primary care doctor. You can even shadow a doctor, but of course I would really recommend, if you can, to shadow a PA. And I would recommend, if you can, to shadow a single PA. That way you can build that really strong relationship with them, and they can write you a letter of recommendation in the end. Like I said, for applying to PA school in my previous videos, your letter recommendations are also a huge key factor for you getting admitted into PA school. So if the rest of your application is lacking, if your GRE score isn't that good, if your GPA is mediocre, it's not very good, or your science GPA, but you have these really, really strong letters of recommendation, it can definitely offset those bad grades or that bad GRE score, etc. So that's why it's really important that you make sure that you get really, really strong letters of recommendation. And the only way you can get that is by having a strong relationship with the individual that you are shadowing, for example, or working with, like the PA. So that's why, if you can, I would say stick with at least one PA. That way you can have a strong relationship with them, and also let them know how much you are interested in becoming a PA and how you want to pursue the PA career, etc. And then of course, make sure that you always are there on time. That's a huge must for clinical rotation. So for clinical year, for every rotation, we have our exams, of course, and then we have our OSCE, which is basically where you have a fake patient and you go and you see them and you perform the physical exam and your diagnosis and whatever labs. It's as if you were seeing the patient, but you have a professor that's grading you. So you have that percent of your grade, your EOR, which is an exam, it's multiple choice. And then you have your quizzes that you have weekly, and then 10% of that grade is going to be whatever your preceptor. So preceptor is the doctor that you are with that rotation, the nurse practitioner you are with, or the PA you are with, whatever grade they give you. And one of the things that they grade you on is on whether you are there on time, whether you call in absent, or you just don't show up. So you want to make sure that you are there when they tell you to be there. be there. If anything, I always make sure on the first day I was there like 30 minutes early to make sure I'm in the correct area and not having to find where the building's at. And also making sure that you go in every day and you don't miss the days, because you don't want that to look bad on you. So definitely make sure I would start with being on time and not being absent and just having good attendance, guys. Also, don't be scared to ask questions whenever you're shadowing your PA. Most of them, I know some of the doctors that I was with, I would hear them. They didn't tell me personally, but they would get annoyed with students that basically don't show any interest and they're just there to finish the clinical rotation. So I know sometimes during some of your clinical rotations when you start, you're kind of like, ugh, like pediatrics, I don't like pediatrics. I know some of my classmates they would say, I don't like pediatrics. Even me, I was not looking forward, for example, to my pediatrics rotation, but that doesn't mean that when I go to my clinical rotation, I'm gonna be doing the minimum and not really try to learn. And that's something that some doctors and providers pick up on, is that they can see that the student doesn't want to be there and they don't want to learn. So make sure that when you are there, you're asking questions. If you have any questions, make sure that you do want to learn. I know that when you're shadowing versus clinical rotations, you get to do a lot more. If you want to go and touch the patient, you can. If your provider lets you, you want to go and do an auscultation, an abdominal exam, you can. But I know when you're shadowing, you're limited. But just make sure that you are asking questions, that you do make sure that you are showing interest in wanting to learn more, because that's gonna look really well also whenever they write you a letter of recommendation, and it'll help you a lot in a PA school also. And if you can, and if you have the time, I really do recommend also, shadow, if you can, maybe another PA in a different field. Like, for example, you're shadowing currently a PA in family medicine. See if maybe you can shadow one in OB-GYN, or I know ER sometimes is a lot harder, but urgent care, for example, also. And that way you can see, the different roles and how they do practice differently and the environment, etc. But of course, my first one would say to stick with one PA, that way you can have that strong relationship with them. And like I said, make sure that you're interested, you're asking questions. I know I ask my PAs a lot of questions. I would ask them, like, how old were they when they applied to PA school? Do they regret their choice of applying to PA school? Are they happy in their career? What feedback do they have for me when applying to PA school? I know I talked to a bunch of PAs. One of them, some of them applied, were in the military and they applied through the military, so that was a completely different application process in comparison to the civilian process. I also asked them, what did they do before they applied to PA school? What did they use to study for their GRE, etc. And you'll see that they'll give you very, very good constructive feedback on what to do and how to better prepare yourself for your PA school applications. So like I said, definitely when you are shadowing a PA, make sure that you're asking questions, you're there early. If they want you in scrubs, then wear scrubs. If they want you in like a nice business attire clothing, then wear business attire clothing. It depends. I know for my clinical rotations, some doctors or PAs prefer scrubs, but some of them wanted business attire clothing. So it just depends. Just make sure that you are following the rules. Also, make sure that you're nice to the medical staff, like the MAs and the nurses. That's one of the things that when I rotated with some of my different preceptors and doctors, some of the medical staff would complain about previous students that were just really rude to the medical staff, or they just felt very superior to them. Make sure you don't have that attitude at all when you're shadowing, or even in clinical rotations, because that really says a lot about you. And the MAs are your best friends, and they've been my best friends for every rotation, especially when you have the doctor that's asking you questions or how to do certain procedure. You'll see that medical assistants do a lot of procedures, and so I found myself also learning a lot from the medical assistants. So make sure that you're nice to them. You'll learn a lot from them also. If you have any questions and the PA or provider or doctor doesn't know the answer, then make sure you can ask also the medical assistants, and they'll help you out. So be nice to the medical assistants. You can also learn a lot from the medical assistants also. So when you're shadowing also, I would start usually to see how the provider is with the patient. What is their bedside manner? How do they approach them? how they perform certain physical exams, because this will help you in PA school. What questions do they ask? What questions do they start with? And this will definitely help you a lot in PA school. In PA school, you are taught to ask certain questions. For example, for their past medical history, you'll ask when they got onset. I have a mnemonic called OLD card, so onset, location, duration. So say if they're complaining of abdominal pain, you ask them when did it begin, where was the location for the L, D for duration, how long has it been going on for, the characters, C, does it hurt, is it stabbing, is it stinging, what aggravates it, anything that relieves it, any treatments that they tried for it, or any other symptoms that they're having like nausea or vomiting. So make sure you're also paying attention to those questions that they ask. If you can, I would definitely bring a book and write down your notes. On their physical exams, make sure you see how they do certain physical exams. I know most providers that I've worked with do physical exams differently, so make sure that you do learn also how they do the physical exams. And if you can, learn definitely how to take blood pressure if you haven't worked in the medical field before, because in PA school I had an exam on how to take blood pressure, so that is not just a medical assistant thing. Make sure you learn how to do blood pressures, pulse ox, simple things, guys, simple things. And if you have a book, make sure you bring your notebook. I always make sure I carry my notebook during my clinical rotations just to jot down anything interesting, like if it's a disease that the doctor diagnosed him with, which I've never heard about in my life. I go home and I look it up. So make sure you're doing that also. If the doctor, the provider sees, the PA sees a patient and it's something that you've never heard of or something not common, make sure you write it down so you can go home and look it up. You'll see how much it'll help you once you're in your clinical year in PA school and just for your future careers in medicine. So make sure that you're also taking notes also. So yeah, those are my tips, guys. So just to recap, make sure that you're always on time. Make sure that you ask them how they would like you to show up, whether it's in scrubs, whether it's in business attire, and make sure you're not absent. If you tell them you're going to be there a certain day, make sure you go. Of course, if it's an emergency or you're sick, then don't go, but make sure that you're there whenever they tell you to be. And also make sure that you bring a notepad so you're taking notes, and also be very observative, show interest. Don't just stand there and just be like a shadow or an extra body. Make sure that you're proactively asking questions. Observe how their bedside manner is, what questions they're asking, why they gave a certain treatment. If it's something really cool that you've never heard of, like for example during my surgery rotation, I had a patient that had Ehlers-Danlos syndrome. I'm sorry if I'm butchering this, but it was something that I saw my doctor see a patient for, and I thought it was the coolest thing because they had, during PA school, briefly mentioned it, and I think I had a question on it and I got mad, and I remember I bookmarked it, and so I was so intrigued, and so I went home and I made sure I researched everything about that syndrome. And so for example, things like that, if it's something that you never heard of, then definitely write it down and go home and research it. Also make sure that you do develop a really strong relationship with the PA you're working with or you're shadowing. That way they know that you really are interested in applying to PA school and that you're a strong candidate. And that way they can write about you. If you were there every day, your attendance was great, you showed interest, then they can say all that in the letter of recommendation. And always, guys, always, like I said, be nice to the medical assistants. You can learn so much from them with the nurses. Just because you're not pursuing that doesn't mean you can't learn anything from them. So make sure that you also, what I would do sometimes if my PA was busy or my doctor was busy, I would go and shadow the nurses or the medical assistants because they know so much. Learn how to do, if you can, blood pressures and taking pulse ox, etc., because you'll have to do that in PA school. And I know sometimes in some of my clinical rotations, if we were so busy, I would go and start doing that, taking blood pressures, taking pulse ox. So you'll have to do it again in PA school, guys. So make sure if you can, learn a lot about the medical assistants also. They have a lot of knowledge, nurses especially, they have so much knowledge that they can teach you. So make sure that you're nice to them, make sure you also learn from them when you can. Ask questions when you're in clinic, ask for advice also from the PAs, what they did when they applied to PA school, what they recommend to you, etc. Alright guys, I hope this video was helpful. If you guys have any questions, always make sure you comment below, give it a thumbs up if you guys like this video also, or any feedback from me, or send me an email or an Instagram message and I'll get back to you guys as soon as I can. Alright guys, I'll talk to you guys later.